Hi, this is Dr. Christy DeSapri, founding physician of Bone and Body Women's Health. Today I wanted to talk about the cholesterol panel. We know that at midlife we should be checking our cholesterol panel and things will change. So it's really important to have a good baseline and then see what is going to change at the time of menopause and how we can prevent those changes. So first off, if you have a family history of high cholesterol or early heart attack or stroke earlier than age 55 and male or earlier than age 65 with a family history, we definitely want to be checking your cholesterol before the time of the menopause transition. At menopause, we know that the LDL or low density lipoprotein will increase. We know the HDL or the high density lipoprotein, which is the healthy cholesterol, will also decrease. So it's really important to know that these shifts are happening based on ovarian aging and menopause, not just chronological aging. Triglycerides, or the fats, are also measured. When we look at the cholesterol, we look at the LDL, the HDL, the triglycerides, and then the total cholesterol. Now we're able to measure something in the blood called Lp(a), or the lipoprotein, which is basically a measure of their propensity for clotting or inflammation. So that is checked now and can be also genetically determined. When women are at low risk for high cholesterol and do not meet criteria for cholesterol therapy, great. We need to watch that over time. We need to talk about the Mediterranean lifestyle, diet, exercise, not smoking, checking for diabetes risks, and moving on. Many women fall in this intermediate category when we look at calculating something called an ASCVD, or atherosclerosis vascular risk disease calculator. So this is freely available. It's online. Your internist or whoever's looking at your cholesterol should be doing this. We do this and we calculate if the cholesterol is on the borderline high, if we need to intervene, or if we need to do further testing. Things like that Lp(a), a coronary artery calcium score, which is a CT scan of the heart, or if we need to be recommending things like statin therapy, things like atorvastatin, rosuvastatin, and other cholesterol-lowering medications, in addition to, of course, always talking about the Mediterranean lifestyle, weight management, not smoking, keeping our alcohol less than 3 drinks a week for women. So really important to understand what your cholesterol panel is, what those specific numbers mean, and how we all know that at menopause, these will change and shift. And if your cholesterol is elevated, we need to be intervening on that. We need to be discussing diet, lifestyle, hormone therapy, as well as potentially statin therapy to reduce those risks, because what we're really looking to reduce is the risk of a heart attack, stroke, blood clot, cardiovascular disease. And we know that when we look at women, cardiovascular disease is 7 times more likely to develop than breast cancer. So both are important, really important to know your cardiovascular risk factors, and I hope to see you soon.